Can fertility be preserved during inguinal orchiectomy? When it comes to the question of preserving fertility during inguinal orchiectomy, the answer is often yes, especially if the patient has a healthy testicle remaining. Inguinal orchiectomy is a surgical procedure that involves the removal of a testicle and the spermatic cord, typically performed as a standard treatment for testicular cancer. Despite the removal of one testicle, studies show that many men can still achieve fatherhood, with paternity rates around 90% in those with a normal opposite testicle. However, it is important to note that this surgery can impact semen quality and hormone levels. Many patients experience a decrease in sperm count and other semen parameters after the procedure. Research indicates that approximately 85% of men may show some level of impairment, and about 9% may develop azoospermia, which is the absence of sperm, even if the other testicle appears normal. Hormonal changes can also occur, with elevated levels of follicle-stimulating hormone and luteinizing hormone, although testosterone levels often remain stable. For those facing bilateral testicular cancer or who have only one testicle, preserving fertility becomes more complex. In such cases, a partial orchiectomy, which involves removing only the tumor and some surrounding tissue, may be an option. This approach aims to maintain as much testicular function as possible while still addressing the cancer. There are additional strategies for preserving fertility that patients should consider. Sperm cryopreservation, or sperm banking, is highly recommended by major cancer and reproductive health organizations. This allows patients to store sperm before or after surgery for future use in assisted reproductive technologies if natural fertility is compromised. Another technique is oncotesticular sperm extraction, which retrieves sperm directly from testicular tissue during the orchiectomy. This method can be particularly beneficial for patients with non-obstructive azoospermia or those who will undergo chemotherapy, with success rates nearing 70% in selected cases. Lastly, some men may choose to have a testicular prosthesis placed at the time of surgery. While this does not affect fertility, it can help address the psychological impact of losing a testicle. In summary, while inguinal orchiectomy does have an effect on sperm production and can influence fertility, many men retain their fertility if the other testicle is healthy. It is crucial for patients to receive fertility preservation, counseling, and explore options like sperm banking and oncotesticular sperm extraction. Each situation is unique, and individualized evaluations by oncology and fertility specialists are essential to balance cancer treatment with reproductive goals. Always consult with healthcare professionals for personalized medical advice.